name is Dr. Marty Kotlar. I want to thank Dr. Siegel and everyone at Discount Medical Supplies and Discount Chiropractic Supplies for inviting me to do these presentations. I enjoy doing them. I hope you do too. So as Dr. Siegel mentioned, today's topic is healthcare reform, Obamacare. So you could call it healthcare reform, the Patient Protection and Affordable Care Act. You could call it Obamacare. They're all interchangeable terms. Either one is fine. So we're going to be talking a little bit about that today, and I'm also going to provide you with a ICD-10 update, just the basics of ICD-10, because that's coming up soon. So, just before we get started, let me tell you a little bit about myself. Again, my name is Dr. Kotlar. I'm a chiropractor. I'm also certified in CPT coding, certified in healthcare compliance. About 10 years ago, I started a company called Target Coding. Many of you may be reading my articles in Chiroeconomics and Dynamic Chiropractic. Also a speaker for the Coding Institute, Parker Seminars, Foot Levelers, and I'm a guest speaker at many national and state chiropractic association conventions nationwide. Anyone listening to this presentation, if you're a member of your state association looking for a speaker, let us know. Maybe we could work something out. Could get a sponsor possibly to take care of all the travel and lodging expenses. All right, so let's begin by talking about healthcare reform, Obamacare. So a lot of you have been hearing about this, I'm sure, over the last couple of years. Maybe you've done a little research into it. What do you think? You think it's going to be good? Think it's going to be bad? I don't know. I think it's, time will tell. What's interesting about healthcare reform is that as a healthcare provider, chiropractor, medical doctor, osteopath, whatever type of healthcare provider you are, it affects you personally and professionally. See, if you're a, I don't know, let's say you're a airline pilot, well, Obamacare is going to affect you only personally for your own personal health insurance. It's not going to affect you professionally. But as a healthcare provider, let's say you're a chiropractor, Obamacare will affect you personally for your own health insurance, and it's going to affect you and your practice and your patients. So that's, two ways it affects you. So it may be good for you personally, but it may be bad for you professionally. So there's a lot of things that you need to think about when it comes to Obamacare. Most of the providers that I speak to, they immediately think it's going to be bad for their practice. And that may be true. I don't know. I think time will tell. I could tell you right now, how have things been going in your practice lately? Have reimbursements going up or down? Reimbursements have probably been going down over the last 10 years. How about your personal health insurance? I'm sure most of you listening to this presentation, you have health insurance. So how are your premiums been going? I could tell you, I have health insurance. I have United Healthcare. The last 10 years, my premiums have been going up every year. And I don't really go to the doctor that much, but my premiums have been going up every year. So for me personally, my health insurance has been going up every year. From a practice standpoint, reimbursements have been going down. So with Obamacare, is it going to make things better? Is it going to make things worse? Again, I think only time will tell. So let's go through how this is going to affect you personally and your patients first, and then we'll get into how it's going to affect your practice. So your patients or you yourself can go to the Health Insurance Exchange, or some people call it the marketplace. This is a set of government-regulated and standardized healthcare plans from which individuals may purchase health insurance. All of these exchanges must be fully certified and operational by January 1st, 2014. So you and your patients can go to the Health Insurance Exchange. You're going to put in your information, and you can shop around for health insurance. Now, as far as the Affordable Care Act, a lot of this is directed towards the 30 million people that do not presently have health insurance. So 30 million people, about 10% of the American population, do not have health insurance right now. So a lot of this healthcare reform, Obamacare, is directed towards those individuals. So from just a big picture standpoint, you have 30 million people that do not have health insurance. Now these 30 million people will be getting health insurance. Most, at least, will choose to get health insurance. Most of the plans include coverage for chiropractic. So is that good or bad? You have to decide. You see, I'm not here to tell you to like Obamacare or dislike it. I'm not telling you to be a Republican or a Democrat. I'm just here to share with you the facts that are out there, and then you can make a decision as to whether or not you think it's going to be good or bad for you. So a lot of Obamacare is directed towards the 10% of the American population that does not have health insurance. And if you're at a certain income level where you just cannot afford health insurance at all, you just do not have the money to afford health insurance, you will be given health insurance for free. Now that insurance that you'll be given for free will include chiropractic. So again, you have to decide if that's going to be good or bad. So what you and your patients can do is go to HealthCare.gov. Go to HealthCare.gov, and what you can do is, practice on yourself and then start showing your patients how they can start shopping around for health insurance. So HealthCare.gov is the website where you go and you start answering questions. This used to be very complicated. It's been narrowed down to just a couple of questions. It's very simple now. You go in, you put in the state in which you live, you click on family or individual, you click a few things, and then you can start shopping around for health insurance. Now, at HealthCare.gov, when I started doing my research about 6 months ago into Obamacare, I'm surfing the HealthCare.gov website, and I came across a tab that says Prevention, Wellness, and Comparing Providers. I went, that's interesting, comparing providers. You know what I'm going to do? I'm going to go to that site and compare the chiropractors in my area. Just curious to see what comes up. So I clicked on Comparing Providers. When I click on Comparing Providers, it takes me to Medicare.gov, to a site called Physician Compare. So I put in my zip code, and then I had to make a decision. Again, I'm looking for a chiropractor. Do I click on Physician, or do I click on Other Healthcare Professional? So if you're a chiropractor, where do you think you are categorized on the Medicare.gov website, as physician or other healthcare provider? I could tell you I've done this presentation twice in a seminar format, and I've done this couple of webinars. So when I do it in the seminar format live in person, I just did one last week. It's about 150 chiropractors in the room. And I said, where do you think chiropractors are categorized, physician or other healthcare professional? Most of the audience said we're probably under the other healthcare professional. And that would be incorrect. We are categorized under the physician section. So I clicked on that little question mark to see where we're at. And then the physician specialties come up. So I looked for chiropractic. Again, we're under the physician specialties, and then there's a little description of each specialty. So I look under chiropractic. It says chiropractic medicine is a chiropractor who specializes in the adjustment of specific areas of the body, often of the spine, to prevent and treat disease and nerve function. Interesting, right? This is at the Medicare.gov website, seen by millions of people, and it says a chiropractor specializes in the adjustment of specific areas of the body, often of the spine, to prevent and treat disease and nerve function. Wow. Wow, exactly. I think that's terrific. I think that is a great definition of chiropractic, especially coming from Medicare.gov. I don't know who wrote that, but I like that person. Anyway, let's continue now with HealthCare.gov. So put in the state in which you live, family, children. It's going to ask you a few other questions. You could put in your spouse, children, birth dates, and then you're going to click Find Options. So I did this. I practiced this, and it came up with 8 plans, and you could filter this based on how much of a deductible you want to pay, how much of a base rate you want to pay. In some states, you may have 90 plans come up. In some states, only 8 come up. I've done this in various states throughout the country. Now, you should, compare. Maybe you'll want to switch your existing insurance based on this. I don't know. Right now, I pay $1,400 a month for health insurance for me, my wife, and family. There are some plans. I did a little shopping around to see if I want to switch. There are some plans that are more than $1,400, and then there's some that are less. So shop around, then you can click on Plan Details. And again, you should educate yourself on this and then educate your patients. So if they're going to go and shop around at this health insurance exchange, make sure they click on the Plan Details and find the plan that includes chiropractic coverage. Most of them that I click on do include coverage for chiropractic. So make sure your patients are aware that they should choose a plan that covers chiropractic. So let's go over some of the key points here of Obamacare. Many of the plans right now already have incorporated Obamacare. This isn't new. Obamacare became a law on March 23rd, 2010. So it's a lot of, a big portion of Obamacare has already been implemented. Young adults can stay on their parents' insurance until age 26. Insurance companies can no longer refuse to sell or renew policies because of an individual's health status. I'm working with a client of mine right now, 36 years old, chiropractor. He just had to have a section of his colon removed. Pretty bad. He's a young guy. He had a, digestive disorder. He had a section of his colon removed. So now he wants to switch from Aetna to Blue Cross Blue Shield. Well, according to Obamacare, he can. He cannot be denied because of a pre-existing condition. Other key points: insurers cannot charge higher rates because of health status, gender, or other factors. Lifetime limits on benefits and restrictive annual limits will be prohibited. Now, don't get too excited about that. There are going to be limits on chiropractic. Cannot have unlimited coverage. Don't think that. Medicare will provide free annual wellness visits and personalized prevention plans. I'm going to show you quite a few examples of those in a few minutes. New plans will be required to cover certain preventive services with no copay, no out-of-pocket cost to the patient. Each state will decide the minimal essential health benefit. Some states are choosing not to oversee healthcare reform, so it's being defaulted back to the federal government to oversee it, but most states are handling it on their own. If a state chooses chiropractic as an EHB, an essential health benefit, then it is mandated that all plans include chiropractic coverage. Is that good or bad? I don't know. You decide. Now, there are certain preventive services. Now, I've been around a while. I don't think there's any other administration that is focused on prevention than this administration. Again, I'm not saying to be a Democrat or a Republican. You can decide that on your own. But this administration is focusing very heavy on prevention services. So under certain circumstances, a patient can have an abdominal aortic aneurysm screening, and there's no copay. The doctor is not allowed to collect the copay. It has to be done with no out-of-pocket to the patient. So what is that going to do? What does that do? It typically will encourage people to get these tests done because they don't have to pay for it. It's almost like, you know, many years ago we were able to advertise no out-of-pocket cost. So there's no out-of-pocket cost. When there's no out-of-pocket cost to a patient, it induces them, it gets them to come in and have these services done. Well, this administration is saying it's okay. Come on in. Get a blood pressure screening, get a cholesterol screening, get a colorectal cancer screening, get a screening for type 2 diabetes, get counseled for chronic disease, for alcohol abuse. Go and speak to your doctor about nutrition and smoking cessation and alcohol and substance abuse. Go and speak to your doctor and get checked out, and you don't have to pay anything. Yearly preventive care visits for adults. Certain sexually transmitted screening tests, no copay. Mammography screenings. Cervical cancer screening, including pap smears. Breastfeeding counseling and promotion. Osteoporosis screenings. No cost sharing. Next, the 80-20 rule. I don't know how many of you have ever heard of this 80-20 rule, but because of healthcare reform, insurance companies are required to spend a certain amount of money on healthcare. So, for example, those of you listening to this presentation, every month you pay, if you have health, I'm assuming you have health insurance, so every month you pay a premium for your health insurance, right? Okay, so the money that you pay, your insurance company gets pooled, and 80% of the money that the insurance companies collect must be used to pay for health care costs. Only 20%, a maximum of 20%, could be used on administration, paying the CEO, advertising, and all those other costs. Only 20%. So let's say an insurance company only spends 70% of the premiums that they collect on paying for healthcare costs. What do they do with the 10% that's left over? They have to give it back to the policyholders. Some of you listening to this presentation may have received a check. The last time I did this seminar, somebody raised their hand. They got a check for $300. They didn't know why. It's because of this 80-20 rule. About 12.8 million Americans will soon receive $1.1 billion in refunds from insurance companies that overcharge them for health care premiums under the new rules created by Obamacare. The refunds will be paid because of the 80-20 rule, which requires health insurance to spend no more than 20% of customer premiums on administration, CEO pay, and profits. 80% must be used for actual health care. Here's an article I read about more jobs. Will Obamacare create more jobs? Maybe, maybe not. Well, according to the Florida Hospital Association, they released a report by the University of Florida that shows extending health care coverage using the $51 billion in federal funds. Florida is going to be receiving $51 billion in federal funds. Wow. This is going to create more than 121,000 permanent jobs over the next 10 years. So, again, I'm just trying to keep it simple. I'm a chiropractor. If a patient doesn't have a job, they're probably less likely to come in to see me. If this patient now gets a job, they have more money, they have a job, they have more money, then they're more likely to come in and see me. So Is that good or bad? You decide. Now, Obama administration is focusing on prevention more than any other administration I've seen. They're also focusing on fraud more than any other administration I've seen. Obamacare takes powerful steps towards combating healthcare fraud, waste, and abuse. The government has recovered, they've already recovered $10.7 billion over the past 3 years. HEAT, which stands for Healthcare Fraud Prevention and Enforcement Action Team. This is a joint effort between HHS, which is the Department of Health and Human Services, and the DOJ, the Department of Justice, to fight healthcare fraud. They've played a critical role in recovering money due to fraud. High and moderate risk providers and suppliers are subject to unscheduled site visits, and high-risk providers and suppliers will soon be subject to fingerprint-based criminal background checks. So you're a healthcare provider, you're an honest person, you don't bill fraudulently, you don't bill for services that were not rendered. You see a patient, you deliver a service, you charge a fair fee, you get paid, you do everything right. And now you have fraudulent activity going on by other healthcare providers. If those other healthcare providers go out of business or get arrested, is that good or bad for you? It's got to be good, I guess. So the criminals out there that are committing fraud, great. They should get site visits. They should get fingerprinted and criminal background checks. Since March 2011, CMS enrolled or revalidated enrollment information for nearly 410,000 Medicare providers and suppliers under the enhanced screening requirements of the Affordable Care Act. Many of you can relate to this, I think. Many of you received a request to update your Medicare information. You had to go to the PCOS website and update your information. You had to get re-enrolled. Why? A lot of you were calling me and saying, what is this? Why do I have to do this? Why do I have to go into Medicare and put in my information and get re-enrolled? It's to prevent fraud. Those of you that have a Medicare provider number, if you do not bill Medicare for 1 year, your Medicare number will get put into a holding pattern. You won't get kicked out, but you won't get paid. You'll get put into a holding pattern until you contact Medicare and let them know that you're still around and let them know why you haven't billed for a year, and then they'll revalidate your number. Why are they doing that? It's to prevent fraud. Is that good or bad? I don't know. You decide. As a result of revalidation and other proactive initiatives, CMS has deactivated 136,682 enrollments and revoked 12,447 enrollments. Now, let's talk a little bit about how it's going to affect you professionally. Well, I could tell you, you're going to get more new patients. Remember what I said? 30 million people don't have health insurance. Now they're going to have health insurance. That includes chiropractic, hopefully. For most of them, it will. Now they come see you. Is that good or bad? I think it's good, but, you have to decide. So you're going to get more new patients. Be prepared. Between Obamacare and the baby boomers, you're going to be getting more new patients. Now, you don't have to believe me. This is an article from Medical Economics from Glenn Stream, MD, President of the American Academy of Family Physicians. He says the Affordable Care Act will bring an influx of new patients into your practice. Now, some practices won't be able to handle it. Some practices won't like this. Some practices will shut down. So you're going to get busier. You hang in there, you'll be busier. Okay, now on the HealthCare.gov website, it talks about the top 5 ways you and your practice can benefit from the Affordable Care Act. It's interesting that HealthCare.gov is providing a little bit of practice management here. It says expanded insurance coverage to over 30 million people will result in more patients for your practice. Is that good or bad? You decide. Some other key points, non-discrimination. The American Chiropractic Association fought very hard on this. Give them so much credit for making sure this protects the profession, this Non-Discrimination Act. No health plan or insurer may discriminate against any healthcare provider acting within the scope of that provider's license or certification under applicable state law. This will ensure that insurance companies cannot unfairly exclude doctors of chiropractic from practicing under the capacity of their training and licensure. Now, there are benchmark plans that every state must choose. 45 of 50 states cover chiropractic as an essential health benefit. For some reason, 5 states didn't. California, Colorado, Hawaii, Oregon, and Utah have not chosen chiropractic as an essential health benefit. It's funny, California chose acupuncture over chiropractic as an essential health benefit. Now, some of the coverage details for each state, I have a few here. If your state is enlisted, send an email to amy@targetcoding.com, AMY@targetcoding.com, and she'll try and get you the coverage details for your particular state if you don't see it listed here on the screen. Arizona, 20 visits per year. Arkansas, 30 visits per year. Connecticut, 20 per year. Delaware, 30. Florida, 26. Illinois chose a dollar amount of $1,000 per year with their basic plan. It's through Blue Option. Maine, 40 visits per year. Michigan, 30. Missouri, 26. North Carolina, 30. Pennsylvania, 20. Texas, 35. Virginia, 30 visits per year. Okay, so that's a brief overview of Obamacare. There's a lot more coming up, so stay in touch with Discount Medical Supplies and Target Coding for more updates. Now, let me go over a little bit of the basics of ICD-10. Right now, we have ICD-9. ICD-10 is coming. For many, many years, I've heard it's coming. Well, it's definitely coming. Work began on ICD-10 back in 1983. Many countries already use ICD-10, like Australia, Canada, Sweden, Thailand. So on October 1st, 2014, I looked it up, it's a Wednesday. Wednesday, October 1st, 2014, ICD-10 is going to become effective. On Tuesday, September 30th, 2014, will be the last day you use ICD-9. We're going from 17,000 ICD-9 codes to 68,000 ICD-10 codes. Now you might be saying, wow, that's ridiculous, it's going to be crazy, it's going to be confusing. You know what? I think it's going to be a good thing because it's not. Right now, ICD-9, they're just too old. They're not descriptive enough. They don't accurately reflect advances in modern technology. With ICD-10, you're going to be able to report chronic conditions better. You're going to be able to get more specific with your diagnosis codes, and in my opinion, it's going to equate to getting paid for more visits. Yes, there will be confusion in the beginning. Yes, it's going to cause some delay probably in payments, but overall, it's something that should be done. And you know what? It doesn't matter at this point. Even if I thought it wasn't a good thing, it's happening. It's mandatory. So you should start working on the crosswalk. For example, cervical subluxation. The ICD-9 for cervical subluxation is 739.1. Many of you probably familiar with that ICD-9 code, 739.1, cervical subluxation. You do the little crosswalk over to ICD-10. It's M99.11. There are other subluxation codes in ICD-10. I think this one is the best one to use, but we still have a while before this becomes effective. This may change. My opinion may change, but right now, 739.1 is ICD-9, and then we crosswalk over to ICD-10, M99.11. Same thing here for lumbar subluxation, ICD-9, 739.3, crosswalk over to ICD-10, and that'll be M99.13. In about 6 months from now, I am going to be taking my ICD-9 books, which have the most commonly billed ICD-9 codes for chiropractors, and I'm going to do the crosswalk over to ICD-10. So when this book is finished, like I said, in about 6 months, it will be available on the Discount Medical and Chiropractic Supplies website. You'll be able to purchase it there. It'll be very simple. I'm going to take the most commonly used diagnosis codes in the chiropractic profession, and I'm going to transfer them over to ICD-10. Let me give you a few more examples. Neck pain, M54.2. Juvenile idiopathic scoliosis, M41.115. Spinal stenosis in the thoracic region, M48.04. Low back pain, M54.5. Difficulty walking, R26.2. Carpal tunnel syndrome on the right side is G5601. Carpal tunnel syndrome on the left side, G56.02. You see, that's an example of getting specific. Acute traumatic, post-traumatic headache, G44319. Shoulder pain, M25.519. Now remember, shoulder pain, ICD-9 is 719.41. ICD-10, M25519. Herniated disc, lumbar region, M5126. Sciatica, M54.3. Now, low back pain with sciatica. You see, low back pain, ICD-9, 724.2. Sciatica, 724.3. You're not going to have to report both. M54.4 is low back pain with sciatica. Now we have low back pain with sciatica on the right side, and then low back pain with sciatica on the left side. So you see how this is going to get very specific. Now, I've come across a few what I consider funny ICD-10 codes, borderline ridiculous ICD-10 codes that I thought I would share with you. So here's the first one. If a patient comes in and they happen to be the passenger in a spacecraft that crashes upon landing, that's V95.42XA. Patient comes in and says that they were struck by a turtle. That's W59.22XA. Burn due to water skis that catch on fire is V91.07XA. Some of you could be, hysterical laughing right now. Yeah, I mean, these are actual ICD-10 codes. Bizarre personal appearance is R46.1. Very low level of personal hygiene, R46.0. Patient comes in, they got injured because they walked into a lamppost. That's W22.02XA. It's funny, the other day I was walking and I happened to be texting, not paying attention, and I almost walked into a lamppost. It's pretty embarrassing. Patient gets injured in an opera house. You know, I've never been to an opera house, but I just don't think it's a place where there's a lot of contact going on. But I guess if a person gets injured in an opera house, well, that's why 92253. Pecked by a turkey, W61.43. There's a few more. Pain in an unspecified thigh. I don't know. Last time I checked, there's only 2 thighs. I don't know. Maybe if a patient walks in with a 3rd thigh, you would report M79.659. Fracture of an unspecified part of an unspecified clavicle. Again, I don't understand how you would ever use that. S42.009. Struck by a parrot, bitten by a sea lion, struck by a dolphin, bitten by a goose, struck by a duck. I guess, you know, you're working at a zoo, you know, all these things could happen. So those are a few funny examples. Okay, so here, you want to establish a transition game plan when it comes to ICD-10. Dedicate a few minutes at every staff meeting to discuss ICD-10. Establish milestones. Share your transition with your EHR and practice management vendors. Talk to all your vendors about how you can set up a testing before the deadline. Communicate with your vendors regularly. Encourage them to take action now to avoid reimbursement delays. Talk to your vendors about making sure your practice management systems will be able to handle ICD-10 transactions. Ask your vendors about their schedule for training your practice staff members. Identify everywhere that you use ICD-9s. Any function where you currently use ICD-9 will be affected by ICD-10. Look at where you use ICD-9. Look at all your forms. Anything that has ICD-9 on it, got to reevaluate that. Make sure you're training your insurance CAs, front desk CAs, all providers. Plan for a little bit of a budget. Shouldn't cost that much, but you're going to want to go to some seminars and webinars and buy some books or CDs on ICD-10. Start working on your own internal crosswalk. Network with your peers. Talk to your peers. Update all your forms. Make sure you and your vendors allow ample time. And stay in touch with Discount Medical and Discount Chiropractic Supplies and Target Coding for the latest updates. Now, just a few closing comments. We have something called our Smart Choice program. It'll help you SWAN. Some of you may be thinking, what's SWAN? Well, we're about prevention. Most of the providers that work with come to us and work with us because they want to prevent problems. They want to maximize reimbursement. About 20% of the doctors we work with, they're in a crisis situation. They're being audited. A couple have been arrested. A couple have been are being accused of fraud. Many are in a post-payment review. Some have been put in a prepayment audit status. That's the 20% crisis. 80% prevention. That's what I prefer to deal with chiropractors that come to me that want to prevent problems. So if you're smart, you know how to prevent fraud and audits. If you're smart, you know how to strategically bill Blue Cross Blue Shield, Aetna, Cigna, United Healthcare. If you're smart, you should collect cash from many of your products and services. You're not underbilling. A lot of doctors, they're so afraid of audits that they're underbilling and losing a lot of money, which is a shame. If you're smart, you know how to code to the highest level of specificity. If you're smart, you know how to prevent dual fee schedules. If you're smart, you know when not to use modifiers 52 and 59. Again, if you're smart, you know when not to use 52 and 59. If you're smart, you know how to build time codes properly. If you're smart, you'll consider our Smart Choice program. It'll help you SWAN. SWAN means sleep well at night. Also, a couple of things. We have a seminar coming up on June 8th on DCPT MD integration, and then we have a seminar on June 29th in Fort Lauderdale on personal injury, new patient marketing, billing, and coding, so you may be interested in that. So just a couple of closing comments here. You must check with all the carriers you bill prior to submitting claims based on this information. We don't guarantee that the information provided in this presentation will guarantee payment from any insurance company or patient. Target coding is not responsible for any managed care or insurance company rules, guidelines that may change following this presentation. So please understand that these rules change all the time. Laws, rules change. So it's important to do your best to stay on top of any changes that may occur by attending seminars, attending webinars that are given, these wonderful webinars given by Discount Medical Supplies, and joining your national and state professional associations.